Welcome to Breakdown Thursdays, where we separate the fact from fiction from popular fitness advice on social media. I'll be your host, Ashley DeCruz, and without further ado, let's get straight into it. On today's episode, we have a reel from Anya Sharma. Hit
Here's
it.
how I reverse my PCOS and you can do it too.
Great song. So in this reel, she claims to have reversed her PCOS by taking the following measures. She also claims that if you follow these same steps, you might be able to reverse your PCOS as well, which is a big red flag because PCOS cannot be reversed. However, it could go into remission. That reversed to remission, what's the difference? Reversal means the disease is completely cured and will not return. Remission, on the other hand, implies that the disease would be dormant or the symptoms would be subdued momentarily as long as the patient is able to maintain certain conditions. So basically, in remission, there is a high chance that the disease will return. So assuming she may have just fumbled the words, let's give her the benefit of the doubt. So what about that point of leaving medications and solely focusing on the diet? Is it truly possible to manage PCOS without medication? The simple answer is no, and it could be quite dangerous. It may have worked for her, but that does not mean it will work for everybody else. Every individual case of PCOS is different, and it will vary heavily depending upon several factors such as genetics, your environment, and your body fat percentage, just to name a few. Some patients may have very mild or manageable symptoms such as not having many frequent periods or being slightly overweight, while others may have severe symptoms like having no periods at all, infertility, or androgenic alopecia, male pattern baldness. Some could even have conditions like type 2 diabetes, depression and anxiety, or non-alcoholic fatty liver disease, which come associated with poorly managed PCOS. So it is absolutely important to consult a medical professional before doing something as stupid as stopping your medication, especially when there is such a high risk. Actually, let me give you another example. Medication can actually protect some PCOS patients from getting cancer. Oligomenorrhea or amenorrhea is a very common symptom in those with PCOS, and sometimes it could be a cause of having unopposed estrogen, which is just too much estrogen. This causes their endometrial lining to grow and thicken. This is known as endometrial hyperplasia, which, if not taken care of, can lead to endometrial cancer, which is why it is so important for these patients to have progestin-containing oral contraceptives, which helps to balance out the high estrogen levels. So simply put, whatever she has mentioned in the video is not bad advice. Managing your weight, having a good diet, and getting in regular exercise does help to better your condition. In fact, many studies show that losing just 5 to 10% of your body weight can improve symptoms with the menstrual cycle and hirsutism. But again, everybody is different, as showcased in this paper right here, wherein 65 women with PCOS were given a calorie-restricted diet and regular exercise for 6 months. Results show that all women lost very similar weight. However, 15% of them showed persistent or no change in symptoms. 47% of them had partially better symptoms, and the rest had a complete disappearance of symptoms. So what does this tell you? Just that every case of PCOS is different, and giving advice like leave medications is just not right in the slightest. Besides, weight loss takes time, does not happen overnight, and so you need something to help you manage your current condition and help you reach a better place, and that something is medication. Yes, the goal should be to better your condition and possibly reduce the dependency on medications, but the complete removal of medication is a decision you need to take with your doctor based on your condition, your symptoms, and how well you're progressing towards getting better. And I'll leave you with that. Hope you enjoyed this, and if you'd like more breakdowns, consider supporting the channel by subscribing and commenting below to let me know. See you in the next.